Welcome to the ongoing series of risk management tips for behavioral health care providers sponsored by Negley Associates. I'm Ron Zimmett. I'm a trial lawyer and been a risk management consultant for many years. Here are three questions to ask yourself when you're doing a patient assessment that I think are critical. Before you make a decision about what's the appropriate response to a presenting patient as to whether to intervene or not with treatment, ask yourself these three questions and you're more likely to make a good decision. First, do I have enough information? We see expert witnesses in court frequently contend that mental health care providers had information that was readily available but simply did not consider it and therefore breached the standard of care. So, have you looked at past records? That is, the past records of other providers as well as your own past records. Have you talked to the police or anybody else who brought the patient to your facility? Have you talked to family members who are available and could be called with the patient's consent? Have you done a thorough review of all the records and information that are available to you and compared the information in one set of records with the information in another set of records and compared it with statements made by the patient and others? Question number 2, do I have a reason to believe or disbelieve the patient? We often find in review of records that mental health care providers appear to be taking what a patient says at face value and believing the patient despite other inconsistent information. In fact, in one case, a patient detained in jail was asked whether he had any suicidal thoughts. He said no, and 10 minutes later he attempted suicide by hanging himself. He survived because he was cut down quickly, but a few days later he again denied having suicidal thoughts as to a psychiatrist. He was then transferred to a less supervised unit and then completed the suicide by hanging soon after he denied suicidal thoughts. You could also ask in this regard, why do I believe what a patient says now will not change in some short time later? And question number 3, have I given family comments enough consideration? When you have permission to talk to family members, they can provide information which is critical to your consideration. I'm aware that some family members come to mental health facilities with their own agenda for the patient, so you should of course be skeptical, but in the right circumstances, family members may know a good deal more about a particular patient than you do, and their wishes about treatment should be considered. If your ultimate decision is not to follow the suggestion of a family member, you should have a well thought out reason why. So that's our risk management tip for today. I'm Ron Zimmett on behalf of Negley Associates. Thanks for listening.